Department of Health, directly overseeing the operations of the department and engaging with the Victorian government in relation to the aged care issues currently that we're addressing in Victoria. Of course, Professor Kelly would normally join me on broader issues and will continue to do that in our normal updates and briefings, whether it be on National Cabinet or on broader reporting that we do on the pandemic. But given that Professor Murphy is the one directly responsible in his duties as Secretary for the Health Department, that's why he joins me here today. I just want to make that very clear. Everyone's doing a tremendous job amongst our CMO team, as they are in the Department of Health, and as you know, there are many challenges. The situation that we've been facing, particularly in recent days and weeks in Victoria for aged care, has been very distressing. It is very distressing, first and foremost, to the families of those who have loved ones in aged care facilities. The most vulnerable in our community have always been our highest concern when it comes to managing the health issues associated with this pandemic. That has always been true for the elderly, but it has also been true for those who have many other comorbidities, those who are undergoing chemotherapy treatment, those in Indigenous communities in remote areas. We have always been very aware of those who have been most vulnerable in our community. And elderly persons, particularly those in facilities, which these days, as we know, aged care has changed. It's one of the reasons why I called the Royal Commission into aged care, because the nature of the demands on our aged care services have changed. In many ways, aged care facilities in many instances have become a form of pre-palliative care in Australia. Many years ago, that was quite different. But these days, particularly with the in-home aged care options that we are continuing to expand across the country, more Australians are choosing, and it's a good choice to be able to make, to remain at home. But those who are moved into aged care facilities are often moved in at a much more advanced stage. And all of us who have had to make those decisions in relation to loved ones understand that. And so I think that attaches to it a particular sensitivity in the challenges that we're now facing. The challenges of dealing with aged care are not unique to Australia, and indeed in every country in the world where there is sustained community transmission, it is inevitable that this will find its way into aged care facilities. When it rains, everyone gets wet, and that is what we're seeing with broad-based community transmission in Victoria. As the Premier rightly said, if you are ill, do not go to work. That is true if you work in a meat processing plant. It is true if you work in a chemist shop. It is true if you work in a restaurant. It is true if you're a journalist, a politician, whoever you may be, an aged care worker especially. We have, I think, over 750 healthcare workers, in particular in Victoria, who have been infected with COVID. This is the product of community transmission. And whatever workplace it is, then workplaces are vulnerable, and that's why the Victorian government has rightly put in place the protections they have to try and protect against that workplace transmission. Now, in relation to aged care facilities in Victoria, there are over 430 such facilities in Melbourne. It's a large number of facilities. We have seen some very distressing and concerning situations arise in a handful of those facilities. In facilities such as St Basil's, in facilities such as Epping Gardens, where we've been working very consistently over recent days, in Kirkbrae. There are a range of other facilities where there have been COVID cases, around 13, that we are keeping a very close watch on. And there are facilities outside of that list of 13 who are obviously in areas where there is community outbreak, which we are also watching, but they are in not what you'd call the critical list of facilities where we have a keen level of focus. So it's important to understand, because I could understand if people in Victoria or even elsewhere, as they're seeing unfold the very distressing stories out of St Basil's and the other facilities that have been affected most acutely, that they would have concerns about the facility where their family is. The good news is broadly across the aged care system in Victoria, we have been able, together, working together with the Victorian government, able to avoid those quite distressing scenes in the overwhelming majority of those facilities. But we will not be complacent about it, and the establishment of the Victorian Aged Care Response Centre has been a key initiative to ensure that we continue to stay on top and hopefully ahead of any potential threats that may emerge in those facilities. I'll ask Professor Murphy to speak to a number of those distressing cases. As I said yesterday when I was in Queensland before returning here yesterday, I want to be as upfront with you as we possibly can about what has occurred in these facilities, and I said the Royal Commission will have absolute ability to go into the intricacies of these issues, and I hope they do, because all lessons always must be learnt. But in the meantime, happy for us to convey as much as we possibly can, because I believe that can provide some assurance to the public that we are aware of the problems that have occurred and, more importantly, are taking actions to deal with those problems and to try and prevent them in the case of any outbreaks that may occur in the future in these facilities. But I do stress the principal cause for transmission into aged care facilities has been through workforce transmission. It has principally come through the infection of staff more broadly in the community, in many cases completely unaware of that infection, and by the time they became aware of that infection, then obviously they had been in those facilities. And that is true in many workplaces around Victoria. In the case of aged care, then obviously the consequences of that and the implications are far more serious for those to whom they're providing that care. The actions that have been taken have been to principally address the disruption in workforce in these facilities. Where cases have been identified in facilities, there had been an immediate isolation of entire workforces in these places. Now, if you take out an entire workforce in a facility, that is going to have obvious impacts for the continuity of care, and very distressing consequences have flown from that. They trouble me deeply. I know they would trouble the Premier equally deeply, and our Ministers for Health. We are all very distressed by those events that took place in those few facilities that were affected in this way. And so it has been important in those cases to move as quickly as we can to get workforces into those places. Those workforces have been drawn from broader nursing staff, but also in particular in the Epping Garden Centre. They were supported by the ADF and on one occasion arranged quite late into the evening. But going forward, the key actions that were necessary were to ensure the cessation of all unnecessary elective surgery and to free up the private and public nursing workforces to support those aged care facilities. The aged care facilities that are in the most distressed situation you wouldn't describe as being in a normal aged care environment with residents. They have moved effectively into an inpatient care type facility akin to what you would see in a hospital. And so that requires, in many cases, an even higher standard of nursing care in those places. And so getting access to that private and public working nursing workforce is a critical part of the solution to ensure we can move people quickly into those situations. So I welcome the decision of the Premier yesterday to make those decisions in relation to elective surgery. That is already making a very big impact. And I want to thank particularly the hospitals that have been in the clusters of areas around where these facilities are in working so quickly with our team in the Victorian Aged Care Response Centre to be able to make those staffing available. The second area of response was to transfer patients, because they had become patients in most cases, out of aged care facilities into both public and private hospitals. That has been an essential action, both to ensure that those Australians were getting the support and care they needed, but also that the facilities themselves could be brought back to a level of operations where the workforce could support it, and those who remain in those facilities could get the standard of care that we would all expect. And so I thank the Premier also for his agreement to that step, working together to solve the problem. And that has also had a very significant impact. Last night, Professor Murphy can update you on this, but we had significant further transfers out of Epping Gardens, I understand, but there was also I think Wyndham Lodge as well, where we had some transfers, Brendan, yesterday, and a number of other facilities. That is relieving the pressure on those places, and that is welcome. A third part of the response has been the calling in of AUSMAT teams. The first of those I anticipate to arrive tomorrow. Those teams we hope to get up to 5 within a reasonable period of time. They are teams of 7. They act as a first responder, if you like, into places that are going through a critical response need, and to stabilise the situation and to provide not just the medical and clinical support, but the leadership, medical leadership that is required in those critical situations. And that is something that they can supplement very, very effectively. And we welcome that support as well, and that has been arranged, of course, by Minister Hunt to go in as part of that response. There is also the broader work which is being done on infection control. Professor Murphy can go through those figures, but some 150,000 aged care workers have been trained with those training modules that have been provided through the earlier response provided by the Commonwealth. It is also important that will now be refreshed, and part of the task that is being undertaken through the Victorian Aged Care Response Centre, led by Joe Buffoni, has been to now coordinate teams to be going into facilities across Melbourne to ensure that we're getting compliance with infection control procedures. Part of the response team that has been going into places like St Basil's and others has also, in particular in Epping Gardens today, involves geriatricians as well as infection control specialists working together with senior nursing staff to ensure those facilities can be stabilised. St Basil's, I'm advised now, has been brought to a stable position, and we're working very hard to ensure that Epping Gardens is in that position as quickly as possible. The other critical part has been in communications, and I want to commend Minister Colback for the work that he's been doing to ensure that we're getting as much communication to families as possible. As you know, there will be a principal point of contact for every resident with a family. And today I'm advised that there will be outward calls to all of those family contacts in the Epping Gardens facility. That has already been done in relation to St Basil's, and that is the practice that has been put in place. There is also a system that has been put in place where Services Australia is supporting the communication to families, working with the nurses and others in the facilities who are providing those details to Services Australia so they can be communicated directly to families. It is our endeavour to contact families as often as possible to ensure they have the information of what is occurring with their loved ones. I will leave it to Professor Murphy to go into more details of the response, but since returning yesterday, these are the things that have been put in place. I genuinely want to thank the Victorian Government for working with us to get these solutions in place. These are our shared responsibilities, as the Premier and I know. We've been in contact with each other this morning. We'll be speaking later today. We have been in regular contact over these issues, and I want to assure Victorians in particular, but Australians all around the country, Premiers, Chief Ministers, myself, our officials, our teams are working together to just focus on the problem, to solve the problem, and to keep Australians safe. That's my sole objective. Now, more broadly on the Victorian response, we continue to support that effort. The ADF obviously highly involved with that tasking, and I can note today that the door-knocking task that the ADF have been involved in will be expanded. That's proving to be very effective, and so further resources are being directed towards that task. The testing regime in Victoria continues to run at a cracking pace, and I commend them for the rollout of that program. Also, I want to thank all states and territories. Last Friday, as I said to you, we agreed a national dashboard of key data that enables us to track even more closely the performance of all states and territories as they're going through their testing and their tracing regimes. Now, for many states and territories, we welcome the fact that they are entering zeros into those data sets. And long may that be the case. But when those numbers move, that it's important that we are able to identify those as early as possible. It is also pleasing to see that the outbreak in New South Wales is being contained. That has now been the case for many days. And again, I commend the New South Wales government and the excellent tracing work they've been doing to stay on top of that. The response down in Batemans Bay has been particularly welcome, and I'm pleased to hear that the situation there has stabilised significantly. And the broader cases that have been identified, they have moved on extremely fast to ensure that they can be contained. Just finally, I just want to make a couple of points on the economic issues. It is clear that the Victorian wave that Australia is now experiencing, and that's how I have to honestly describe it. I mean, there is not a second wave that is going across the rest of the country. That is not occurring. There is a significant Victorian wave, but that Victorian wave is impacting the national economy more broadly. We're seeing that in the payroll data. That is one of the most timely data sets we see on employment. It is affecting other states. We're also seeing that on things like table bookings at restaurants and in states that aren't affected by COVID in the same way that Victoria has. So that's what I mean when I say Australia wins when Victoria wins. It's in the national interest, not both from a health perspective, but from an economic perspective, that we ensure that Victoria wins here. And we're all backing Victoria to win, and we're all putting everything we can behind Victoria to ensure they can do that. And where we have shared responsibilities, we are working incredibly closely together. I also welcome the announcement by APRA today, made before markets opened, which will ensure banks will have continued flexibility to be able to deal with the commitments that their clients have on their mortgages and business loans and things of that nature. And I think that has shown a fleet-footedness by APRA in response to the crisis. Also of interest, the Australian Office of Financial Management announced the syndication of a $15 billion 30-year bond. That is the second, I understand, of those 30-year bonds. One was done when I was Treasurer. They locked that in at some 1.94%. That means that we are changing the profile of our debt and ensuring that the interest costs on our debt, which have had to rise significantly, the amount of new issuances we've had has been at record levels. Combined together with T-notes, we've raised just under $200 billion in recent months, 197.6 to be exact, 132 through bonds. And these have been oversubscribed. And that is an indication of the confidence that the world's financial markets have, both in how Australia is managing, I think, the COVID pandemic, but also the financial management of the country through this pandemic. And with that, I'll pass you to Professor Murphy.
Thanks, Prime Minister. So in this evolving global pandemic with nearly 17 million reported cases and multiples of that unreported almost certainly, one of the key lessons is that where you have sustained significant community transmission, there are tragedies in aged care. Aged care cannot be completely protected from sustained community transmission, as we have seen in Victoria over recent weeks. Despite all the preparation, the infection control planning, the deployment of PPE, the pandemic and infection control plans that every facility has created, the restriction of visitors, the staff screening, all of those cannot protect against what the Prime Minister said was the inadvertent bringing into the facility of this virus. One of the things we have all learned about this virus in the last 6 months is this terrible combination of a virus that can spread so easily in fit young people, sometimes without any symptoms, and yet when it gets into our frail elderly people, it wreaks havoc, and it has a very significant death rate. Fortunately, some do recover, but it is a very, very nasty virus with the elderly. We have always said from the beginning of this pandemic that we cannot completely protect our elderly unless we control community transmission. So We do have outbreaks in 77 of our residential aged care facilities in Victoria. That's about 10% of the 770 thereabouts residential aged care facilities in that state. And given that there are 465 facilities in the outbreak hot zones, that in some respects shows just how well the others have done given the widespread community transmission that has occurred across that hot zone of the Melbourne metropolitan area and Mitchell Shire. Many facilities have protected their residents with extreme attention to detail and focus. It's not the fault that those facilities have outbreaks, that they've had cases introduced. We know that residents have often, families have said that sometimes they've observed breaches, and we will look into any issue in the retrospective analysis of these significant outbreaks. But these incursions of this virus into facilities are essentially unavoidable. For most of those 77 facilities, there have been only one or two small cases. The public health response has been swift and prompt. Isolation, quarantining of contacts has brought the facility under very good and early control. In others, there have been substantial and bigger outbreaks. We have 13 facilities that we are keeping a very close eye on at the moment, many with more than 20 cases. We now have across all of aged care, including home care, 456 residents who are now COVID positive. That's still a relatively small proportion of the cases in Victoria, but it is probably the highest concern group of people that are infected with this virus. There are also 381 staff who have now contracted COVID virus across the aged care sector. On top of that, there are many hundreds of hospital and healthcare workers who have also contracted coronavirus, and there are also many hospital staff who've contracted, not hundreds, but there are many hundreds of hospital staff who are in quarantine and isolation. So the loss of staff with the virus, the loss of staff who are in quarantine, both in the aged care and hospital sector, has put a huge strain on the workforce supply. It is essentially one workforce across health and aged care. That has been one of the most significant factors. The most tragic part of this aged care outbreak is that there have been 49 deaths in aged care. That is a terrible tragedy, and there will be more. There will be more deaths with the number of aged care recipients that are infected. We know that, it is a certainty. We will see deaths every day, and that is a tragedy. This virus, once it gets into many frail elderly people, has an inevitable fatal outcome in some cases. There is no effective treatment. As we know, there are some treatments that can help a bit in some people, but essentially it has an inevitable outcome. Our hearts go out to the families of those people who have lost their lives, and to those families who will lose their loved ones in coming days and weeks. This is the concern above all that hits us in the health sector in this COVID pandemic. And that's one of the reasons why you've heard the Victorian Premier and the Chief Health Officer there talk to those younger and fitter people who aren't sick, who are spreading this virus in the community. That's the consequence of not doing the right thing if that is happening. I will talk a little bit about two significant outbreaks. The first one that occupied us over many days last week and on the weekend was St Basil's Home for the Aged. That, as the Prime Minister said, we had an event that we have not experienced before in the outbreaks such as in New South Wales that we've had before, and the other outbreaks in Victoria, where the nature of the outbreak was that the public health officials in Victoria decided that the entire staff of that facility should go into quarantine, management, staff, everyone, the whole staff. So we had to find in partnership with Victoria, a new staff, new leadership, and that staff had to be found in a context where there essentially were no spare staff in Victoria because of the number of staff and contacts that were in quarantine and isolation. So it was very, very difficult. Staff were found from all sorts of sources, but they were not staff that knew this community, and there was no doubt that there were a very challenging situation and there were clearly deficiencies in care. Once those deficiencies in care became widely known to us last weekend, we immediately moved to decant residents from that facility. 64 have now been moved to hospital settings. There are 32 remaining. There is new management on site, and all the reports are that this facility is now well managed and care is good, and we have that independently verified from a number of sources. But there were clearly deficiencies in care last week, and stories which you will have heard reported and which trouble all of us about that. And obviously the Minister for Aged Care, Minister Colbeck, has undertaken to the families that we will do a review of that outbreak as we did in the two big outbreaks in New South Wales. Biggest concern at the moment is a facility in Epping Gardens. Again, a facility where the great majority of the workforce had to go into quarantine, and a workforce had to be found very quickly, and that has been done with the huge support of the public hospitals in Victoria, who also don't have any spare workforce, but they've closed beds and wards and closed operating theatres with the elective surgery cancellation, and freed up their workforce to go out and support this facility. There are still issues in that facility. I understand that there are still concerns from families and staff. We are in the process of decanting a substantial number of those residents, up to 45, out of that facility. We are putting in some very senior workforce to cope with the loss of the many senior staff from that facility who unfortunately had to quarantine. We're very confident that we'll have that facility stable like St Basil's in the next 24 hours. There are 11 other facilities with significant size outbreaks, as the Prime Minister has said. Many of those facilities have quite large numbers of cases, but they are managing extremely well. Some of them they've all cohorted those residents. Lessons that we learnt from Newmarch and Dorothy Henderson Lodge in New South Wales. Some of them have a floor of positive, a floor of negative. They are being supported by their local hospitals. They're being brought in to with nursing staff, infectious diseases physicians, public health physicians, and as the Prime Minister said, they're setting up a hospital in the home type environment in the residential aged care facilities. Many of those facilities have also decanted staff to private hospitals in significant numbers when they feel the load on the facility or that those residents need hospital care. On no occasion has there been a situation in Victoria where a doctor or a clinical staff member feels that someone would benefit from hospital care when that hasn't been provided. But given the events of the last few days, we have spent a lot of time with the Victorian Department of Health working out ways to ensure that these sort of staffing shortages don't ever happen again. And we have now got a very strong agreement that priority will be given to meeting the staffing needs of every residential aged care facility with public hospital staff. They're the only staff at the moment we have left. We are looking at trying to bring in from interstate additional nurses and trying to recruit new personal care workers from nursing students and other sources. But at the moment, the only staff that are available when there are mass quarantines of staff are the hospital workforce. And I can say with incredible gratitude to my colleagues who run the hospitals in Victoria how much they have stood up and provided senior nurses, teams of nurses, to go into facilities where there are staff shortages, where staff are in isolation or in quarantine, and step in and fill the gap and provide that leadership. And we've seen that in several facilities over the last 24 hours, and we have a guarantee now that this will happen, and we will make sure that at no stage do we get a staffing situation which leads to those significant deficiencies in care. We also have, with a very welcome announcement of the Victorian Government, the cessation of non-urgent elective surgery. We're freeing up significant private hospital capacity across Victoria, and we will continue to transfer residents with COVID or with high care needs from those facilities where it's seen necessary to make the care environment safe. You can make the care environment safe, as we have seen in St Basil's at the moment. There are still some positive cases there, but things are stable and good by all accounts. So there are many other things we are doing. As Prime Minister and Minister Hunt have said, we've set up a joint Victorian and Commonwealth Government aged care response centre, where we now have a number of senior clinical staff, infection control, geriatrics, senior nursing staff, to respond to these issues, to rapidly deploy to a facility that has any issues. We've set up a workforce agency which will recruit staff from interstate, fly in some nurses from other states, create a new pool of nurses to help and personal care workers to help support these facilities. We're also going to deploy a range of infection control enhancements. As the Prime Minister said, there was extensive training in infection control, but when you're busy, things can slip, and you need to have people coming in to supervise, ensure that you're doing the right thing. As Minister Hunt announced, we're also deploying face shields. Staff in residential aged care facilities are now wearing masks routinely, but if we can put face shields on top, that provides additional protection, stops people touching their mask, and ensures that people are much more aware of infection control practices. We'll be also making sure that every facility is visited by an infection control expert that can ensure that the training is up to date and that people are refreshed in that way. We are very, very keen to make sure that those facilities that don't have outbreaks continue their excellent protection and practice, and we want to help bolster them. It's been very difficult for families that, because they have been generally prevented except in limited circumstances for visiting, but we have to keep anyone unnecessary out of these facilities to protect the residents. Finally, I wouldn't be remiss of me not to say that the most important thing we can do to solve the residential aged care outbreak in Victoria is to control that community transmission. So to all of my fellow Victorians, and I am a Victorian at heart, please do what your Premier and Chief Health Officer are saying. Please keep that movement to the absolute minimum. Please do what you're being asked to do. Do it for your elderly fellow Victorians, because it's the community transmission that has caused this problem. Thanks, Prime Minister.
Thanks, Brendan.
Given they're regulated by the feds, how do you respond to this quite low criticisms of your government's handling of these aged care facilities? And is there blame shifting going on?
I'm not interested in any of that. What I'm interested in, I know what the Premier is interested in, is us working together to solve the problem. And the reports of, I think, these things about how the Premier and I are working together are greatly exaggerated. The Premier and I enjoy a very good working relationship. We enjoy a high level of respect for each other and the responsibilities we each have. And we'll continue to conduct those responsibilities as the public would expect us to do, and in fact, as each of us would expect us to do. And I said earlier that all of us, many of us I should say, have had to make decisions about our elderly loved ones who have gone into aged care. And it's an even harder decision these days, because we know that we're, in many cases, if not most, we are making decisions about placing our elderly loved ones into pre-palliative care, and that was certainly the case with my own father last year. And they're difficult decisions, because you are coming to terms with what you know is the situation. And so I completely understand the emotion that is around this issue. We saw this with Minister Hunt yesterday, and I understand the emotion of whether it's the Premier or anyone else about these issues. And that's why I think we have to deal with them sensitively, which is what we're seeking to do. That's why I'm so appreciative of some of the heroics of the nurses and nurses' aides and assistants that have been working in those most affected facilities is truly extraordinary. Whether it was the ADF nurses that went in at 11 o'clock the other night into what was one of the most challenging circumstances they have certainly faced, or whether it those who just bravely got out of bed each day and said, I'm going back to work today. I say thank you to them. They have concerns, and we want to allay those concerns, particularly with the practices that Professor Murphy has outlined today, whether that's in the provision of PPE equipment and the additional support going into infection control, to assure the aged care workforce that they can get to work. They shouldn't go if they're not well, obviously, but those protections can be in place, and that's what the Premier and I are keen to, I think, reinforce. The entire system depends on that operating effectively. The aged care system has challenges in it because of what I've said before. That's why I called a Royal Commission into aged care. I'm not naive to those challenges and the significant demands that are going to be placed on the Commonwealth to respond to those. Already we have made some significant responses when it comes to in-home aged care places, and in the budget we will be making more. But what I am keen to stress today is the context. And the context is that out of more than 430 aged care services and facilities in Melbourne, we have got some very serious and acute conditions in 3, arguably 4. And that includes previously Monarch, which we had to completely transfer people out of. In the hundreds of other facilities around the state, and particularly in the metropolitan area, then they have been managing extremely well. And so I would point to that experience to calm people's concerns, and certainly to not add to the any exaggeration of how that relationship is proceeding. The relationship is a very strong one. We've worked together for some period of time now, and that working relationship undoubtedly will continue to serve both Victorians and Australians, I think, hopefully well. David.
Why learning today that some of this federal intervention is happening? Why wasn't it coming forward at the National Cabinet meeting on Friday? This crisis has been weeks in the making in aged care. Have you acted too slowly on this?
Well, David, you must have missed the announcement that was made on Friday about the establishment of the Victorian Aged Care Response Centre. That's what Professor Kelly announced from that very platform. That was one of the measures that were put in place because of the need to bring together the joint response. And what had occurred over the weekend in particular, which rapidly escalated the situation in a number of these facilities, as I said, was the complete withdrawal of the workforce. Now, that is not something that happened in Newmarch in New South Wales. This was a new situation that had not been anticipated or foreshadowed at a state level or considered at a federal level, that an entire staff of an entire facility where there'd been a significant COVID outbreak would be completely removed, effectively almost immediately. And so that placed an incredible strain on getting the continuity of care, staff that had to be drawn from not the usual sources at different levels of training, doing the best that they possibly could under the circumstances. But it is very distressing what those events led to. And so what you're seeing, David, is that these circumstances that we're facing constantly change, and they present new challenges. The challenges that we have in Victoria are very different to those that we experienced in Newmarch. In Newmarch, the majority of the staff were able to be retained in the facility to ensure that there was a continued continuity of care in those places. There was not broad-based community transmission that led to what occurred in Newmarch. In Victoria, there has been, and that means that more facilities are at risk, and the fact that more facilities have not resulted in the circumstances we've seen in this small number of facilities in Victoria is welcome news and encouraging news. that by and large across the vast majority, overwhelming majority of facilities, that those protections have proved sufficient to date, but we are not complacent about it, and that's why we're taking the additional measures now. So we'll continue to make the response, we'll continue to respond to the cases that present, and we'll continue to work together to get the right response. We'll come back over here, Andrew, and then Phil.
Professor Murphy, welcome back. I bet you've missed us. Can I ask you to update us on the ICU capacity down in Victoria and what thinking there might be, or what planning there might be to boost that from other states and territories, perhaps by transferring patients? And Prime Minister, could I also ask one about pandemic leave? Clearly, you've resolved an issue. You've resolved the issue in aged care, but extending pandemic leave to others to ensure they aren't at work if they are told to be isolated. Can I ask that one as well?
So I haven't got the actual data on ICU capacity, but we're very comfortable with that situation at the moment. The outbreak in Victoria has seen some hundreds of people in hospital, but ICU occupancy is still well within its base, and we have already substantial plans to expand ICU capacity in the public and private hospital system in Victoria. I don't think there would be any foreseeable need in the next, unless we had a very significant increase in the number of severe cases, to do that. This is one of the challenges at the moment in Victoria, is that we have seen this problem in aged care, but the hospital system has otherwise been coping very well. We can get back to you on the current data today on the ICU capacity. I've come prepared for aged care, but all of our reports are that we're very comfortable with the ICU capacity in Victoria at the moment, and with the already planned expansion capacity. There's a lot of potential expansion. That is not a current concern. Obviously, we're watching it carefully.
I think it's one of the biggest differences between now dealing with this Victorian wave and when we're dealing with the broader first national wave, is the concerns we had in that first few months was we had to build up those ICU capabilities. And not only is there that capability in Victoria that has been built up, but obviously around the rest of the country. And as you say, you can put a respirator on a plane and you can move it between states very quickly. So that is, I think, a welcome assurance to people that we have a much higher level of confidence today than we had back in April and March when it came to those issues. On the issue of pandemic leave, it's a matter I have discussed with the Minister for Industrial Relations, and as you know, there are ongoing discussions between the government, employer groups and employees about a range of issues managing the pandemic, and that will be one of them.
Can you explain the effect of Victoria on the economy more broadly? Until the Victorian outbreak, we were sort of on track to reopen a large amount of the domestic economy by now, mid to late July. Can you even estimate or guess when we might reach that point that we're supposed to be at now, given what's happening in Victoria? At what stage we might get to having all the borders open and most of our commerce?
Not at this stage, Phil, with the status of the Victorian wave. I'm significantly encouraged by what we've seen in New South Wales, where there has been a real test of the system with a number of outbreaks, and the capability to get on top of those quickly should give all of the country great encouragement that it is not an inevitable consequence that where there are outbreaks it can result where sadly the Victorian situation has come to. That's not a criticism, they're just an observation of facts. So I think that's encouraging. It says that yes, we can get on top of this when it occurs. So, there are a couple of cases in Queensland today, and a school has been closed for a short period of time to deal with that. I have a lot of confidence, as expressed to me by the Chief Medical Officer this morning, Acting Chief Medical Officer, Professor Kelly, about the response to that situation and the readiness of their tracing capabilities in Queensland. So I think once we get a better read on where these numbers are in Victoria, and hopefully we will see better numbers from Victoria today, but we don't know. But what I do know, Phil, is, and I've got another meeting with that group of what was known as first movers later today, is that a number of those are facing similar challenges to Australia. A lot of countries that went through that first period as successfully or almost as successfully as Australia is now seeing this again. So this is not unique to Australia. But, I was at Walker Seafoods visit I made yesterday was tremendously encouraging, because it just showed a business that was adapting and changing their business model, making use of the supports that were available to make decisions, keep people in work, grow their business, get themselves out of it. And when businesses are doing that and governments are doing what governments are doing, then it is my hope that we can have a better read on that about a month from now. But I think any time before that, I mean, that's, I think, a cautious estimate, a month from now. If we get a better read on that in the next couple of weeks, well, I'll be the first to celebrate that. Mark.
A couple of matters for Professor Murphy. Professor, it's reported this morning that you made a direct request to the Victorian government last week to further restrict elective surgery to free up nursing staff for these aged care facilities, and that when that hadn't been done by Sunday, you're said to have been shocked that that was the case. The Victorian government says the first communication they had with you about this matter was on Sunday, and you didn't make any direct requests. The first direct request came from the Prime Minister in a text message on Monday. Can you clarify those events, please, for the record? And secondly, the operators of Epping Gardens have distributed a memo to residents' families saying that they wanted to transfer the elderly residents to state-run hospitals, and the federal department resisted that. Can you clarify that for us, please?
So I have no evidence that the federal department has resisted that at all. The federal department has been cooperating with the Victorian department to find private hospital beds as quickly as possible, and we're in the process of transferring a significant number of residents. We've got to obviously comply with the residents' wishes and their concerns. I've been in discussion with the Victorian authorities about elective surgery. I first discussed it with a senior official in the Victorian Health Department, I think on the 15th of July, wondering what they were doing with elective surgery. I've had many informal discussions with people late last week. Certainly on the weekend, on Sunday, I did say that this has become really crucial, that this has stopped now, and I did make a very formal request, but we have been discussing this late last week and on the weekend. So I think it's a bit of a storm in a teacup. They had a cabinet meeting and they've made a decision, and that's the most important thing.
WA Premier Mark McGowan has said he won't be lifting the state's borders until he can be confident there's no community transmission in the eastern states. Clearly there still is widespread community transmission, and there's the situation in Victoria. Given this, and given the fact that you've said part of your suppression strategy, the goal is no community transmissions, why is the federal government supporting Clive Palmer in his High Court challenge against WA's hard border?
Well, let me be clear. We're not supporting Clive Palmer. An action has been brought in relation to the WA border. It goes to quite serious constitutional issues which the Commonwealth could not be silent about. And my concern is that it is highly likely that the constitutional position that is being reviewed in this case will not fall in the Western Australian government's favour. And what I'm keen to do is to engage with the Western Australian government to ensure that we can have appropriate health protections for the people of Western Australia, to ensure there is not transmission from areas associated with outbreaks. That was the basis of a position that I've been consistently putting to premiers. It is absolutely critical that we do not get transference out of outbreak areas. That is our government's policy. And so my fear is that if an all-or-nothing approach is taken to the border question, then that will not serve the people of any state well. And so I would welcome the opportunity to come to a position where we can address the genuine concerns that people might have in any other state, but particularly in Western Australia, to ensure that they are covered off. And that is my only real objective here. The constitutional position is one that provides for there to be free movement of Australians across borders. That's what a federation is. And that free movement shouldn't be prevented. There are much more broader consequences of this case that go beyond specifically the pandemic, and that's why the Commonwealth responsibly has to be able to put the responsible constitutional position. This is not done in aid of Mr Palmer in any way, shape or form, in no way at all. I warned the states and territories that if they make arbitrary positions on borders, that they are likely to find themselves in this situation, that someone is likely to bring a case, and that this may well crystallise a constitutional position that wouldn't be to their advantage. So, as I think the Finance Minister and our senior Western Australian has made the point in the West today, very keen to engage in a way with the Western Australian government that protects the health of Western Australians and protects the health of Australia and the prosperity of Australia. And so we are not seeking any sort of conflict here whatsoever. We would like to have a very productive outcome here, but I fear a sort of an all or nothing approach on the case is not the best way forward here, because I think the constitutional position is fairly clear. Now, it's not for me to bush lawyer that. I'm not even a lawyer, let alone a bush lawyer. So that's the advice I have from the Attorney-General, who was also a Western Australian. So I'm concerned about the sort of combative way that this is unfolding in Western Australia, and I would like to find a much more productive way forward.
One of the consequences on your role as PM of COVID has been your ability to travel overseas to meet global leaders. We obviously know that's incredibly expensive, and we've seen that virtual summits have been quite effective in the interim. After the crisis, do you intend to travel normally, or do you think that virtual summits will be a part of the future?
I hope that virtual summits are part of the future. I think there's rarely been a more frenetic period in which an Australian Prime Minister is engaged with other leaders, particularly as we've been dealing with the pandemic matters, and most of my recent calls have particularly been going to the issue of accessing vaccines and their production and things of that nature, and we have another set of those calls later today. But the traditional method of leaders gathering together also can't be underestimated. I mean, I don't think it's a question of either or. I look forward to a time where you can do both. I note that European leaders now are starting to get back to face-to-face meetings under controlled circumstances. I indeed hope to be part of a series of those meetings in Washington later next month. But that is still scheduled to proceed, and I'm looking forward to attending that and intend to should it go forward. So look, I think you've got to get the balance of both of them together. But I think there's been, I think this morning there was a meeting of the Canadian Deputy Prime Minister and our Deputy Prime Minister on these issues, and once again the Canadian government had been very complimentary of Australia's approach to the pandemic. A lot of countries have looked to see what we've done here. You know, we mark ourselves very hard in Australia, and we should. We should mark ourselves very hard when it comes to the care of the most vulnerable in our community, and particularly the elderly. We should mark ourselves hard. And so we should be concerned about the distressing circumstances that have unfolded in Victoria. And that's a good thing. But we also need to understand that you're better being in Australia than anywhere else at the moment. Kieran.
Queensland has declared Sydney a hotspot, the entire Sydney region a hotspot. So from Saturday, residents from Sydney will be blocked from travelling to Queensland after 2 return travellers tested positive. What's your reaction to that? And another question just on AUSMIN and China, because Secretary Pompeo in the last few days said democracies like ours need to try and induce change within the Communist Party leadership. Is that a reasonable proposition? Would you get on board with that?
I think it's wise to ensure that there is no transfer of people from outbreak parts of the country to those where there isn't an outbreak. That is as true for ensuring that there is no transfer from someone in a suburb of Sydney to another suburb of Sydney, to another state or territory. I think it's important to sort of put borders aside when it comes to those things. If you're not in an outbreak zone, well, you don't want people moving to where you are, and otherwise you end up in the situation that we have ended up in broader metropolitan Victoria. So I think that's very sensible that you limit movement of people out of outbreak zones, and I support that very strongly. That is the basis of the position that I've been advancing to the states and territories from the very outset. I talked about the need for testing, tracing and managing outbreaks. That is how you manage the pandemic and you keep your economy running. Now, on the broader issue of the AUSMIN meetings, which have been very successful in Washington, and These are good opportunities, as the G7 Plus, as it effectively will be when it meets hopefully later next month, and other meetings of that nature. These are great opportunities for like-minded liberal democracies of developed economies to come together and share common views about how we work with each other, how we develop our economies, and how we work together to promote peace and stability globally, and particularly in the Indo-Pacific region. And that has been the focus of these talks that we have had with AUSMIN on this occasion in Washington. And so I would agree that the more that like-minded liberal democracies, particularly those developed economies, but broader than that, the participation, I think, of India in these discussions, which both Prime Minister Modi and I were able to attend in France last year, this is very helpful. The like-minded partnership that is which is strengthening between Japan, Australia, the United States and India, not just on economic issues, but broader strategic issues, I think contributes to a strategic balance in the Indo-Pacific which promotes peace and stability, which is what we want. We want a successful Indo-Pacific prosperous region. We want China's economy to be strong and successful. We want Malaysia's economy to be strong. We want Indonesia's, we want Australia's, we want Japan's, Korea's, Myanmar's. We want all of these places to be strong. And for that to happen, it has to occur on the basis of a stable balance within the region. And I think the cooperative way which like-minded developed economies, liberal democracies, are coming together, I see as a very positive force for peace and stability. I suspect Chris has a question along similar lines.
You've answered so magnificently, I'll move on. You've mentioned the 30-year bond issue.
Yeah.
There's been a lot of talk recently about modern monetary policy. Essentially, a government can borrow from itself forever. Are you compelled by that idea?
No. Paul, you've been very patient.
Yeah, on pandemic leave, when did you ask the Industrial Relations Minister to consult on that issue? Does that indicate you're now inclined to provide it? And why now when unions have asked for this for months?
I've spoken about that in recent days.
Can I ask, Senator Holly Hughes attended one of the COVID-implicated Sydney restaurants and has chosen not to self-isolate, I understand.
I'm not aware of the circumstances of that, so I can't really comment on it.
So,
well, I suspect he's giving Netflix a pretty good workout. Hopefully he's doing a lot of work on other briefs and things of that nature, which I suspect he more likely is. But I think what that demonstrated was the rapid nature of the response of the New South Wales tracing effort. And he was contacted very readily. I was informed of that on Sunday evening, and immediately made the decision that he obviously wouldn't be travelling the next day when I was going to Queensland. And on Tuesday when we were going to Queensland, and then we took the appropriate advice from the acting chief medical officer about how that was managed. I mean, as you've probably observed, we're a little more strict on how we practice social distancing than clearly the press gallery is today, and as they are on most occasions when we're standing out here. But we do follow that. And I want to thank particularly my staff and the medical support I've provided, and my own doctor here in Canberra, who takes regular checks on me, and that's practiced pretty significantly here to ensure that I don't provide vulnerable, just the once. Yeah.
Prime Minister, are we in danger of being caught in a pre-election vortex with the Trump administration?
Sorry, I couldn't quite
Are
hear.
we in danger of being caught in the pre-election politics in the United States? Is that why we're slightly at odds on some points in that AUSMIN letter and not as strong as the United States at home?
Well, Australia sets its foreign policy on our own national interests. And while we have the deepest and most lasting of friendships and alliances with the United States, that doesn't mean we always share every view to its most minute detail. And there is often a difference in nuance or emphasis or timing and on occasion in substance. And part of that is because of our economic composition and relationship with our region is different to the United States. And so those economic interests will be different. But there's no doubt about the core of that friendship and that partnership or about its objective. Now, we're both passionate, vibrant, liberal democracies, and thank God for that. And that means that in the season of politics, which is the electoral cycle, as is occurring wonderfully in New Zealand as well and many other democracies around the world, there'll be elements of politics that comes into that. We see that in our own domestic situation. There are some state governments going into elections, there are others who are not, and that influences the policy and political debate here in Australia as well. And I think we're all capable of separating those issues, and I have no doubt in the engagements I have with leaders around our region that we can factor out what's the noise of politics and be able to focus clearly on the issues of substance.
Some government has commissioned reports following the outbreaks at Dorothy Henderson Lodge and also at Newmarch House. Why haven't those reports been made public yet? Have they not been finished, or are you looking at them internally? And just to Professor Murphy, you've today said that you're going to be sending infectious disease experts into all the aged care facilities. Why was that not done until now, given the deadly impacts that we've already seen have?
I might ask Brendan to update on both.
So the Newmarch report is not completed yet. The Dorothy Henderson Lodge report has been provided to the Royal Commission, and that will make it in the public domain, because the Royal Commission into aged care has had a significant interest in these aged care outbreaks, so that will be published on the Royal Commission website. But the Newmarch report isn't even completed yet, so that study is still going on. Well, you don't do these reviews until things are completely settled down and there's a calm, and you don't do a review in them when things are still active. So, and the Newmarch review was a very long and complex process, and it obviously had to be done remotely because people were in different states. So it's taken about 3 or 4 weeks to do. It's being written up at the moment, and it will also be provided to the Royal Commission. It will also come into the public domain. The lessons we've talked about on many occasions. The lessons are that you need to cohort people. You need to obviously do communications. Newmarch, the most important lesson was communication with families was the biggest breakdown. The care and the infection control was strong. One of the lessons at Newmarch was bringing in very good infection control experts, which New South Wales Health did, and having really good PPE. So in terms of the Victorian infection control, there has been a lot of infection control training already. There was lots done early in the pandemic. There were road shows, there were online modules, facilities did their own. What we're now saying is we've got freed up some workforce with the cancellation of elective surgery of some experienced theatre nurses, so that we've got a larger pool of people who can go out and just repeat the training that people have had already.
We have time for 2 more.
Deflation first time in 20 years. Can we get it?
We'll get one and Matthew.
To follow up on pandemic leave, given the urgency of the situation in Victoria, can we expect to see something on that sooner than the October budget? And have you looked at the cost of not doing it, the cost to the broader community, and not just the actual dollar cost of doing it?
Well, those discussions are continuing, and when they've completed, we'll make some announcements.
Yeah, sorry, just deflation first time in 22 years. Is that a good thing or a bad thing for households?
Well, look, these most recent numbers are, I think, quite unique to the rather extraordinary circumstances we find ourselves in. What I know is good for Australia is people getting back into work. What I know is good for Australia is businesses having the confidence to open their doors again. What I know is good for Australia is that when there are more people in work, then that is providing the revenue to support the essential services that Australians rely on. We're going to see lots of numbers that will be interpreted many different ways, and I'm not going to provide a commentary on that. A good example is a point I was making last week, and this is the issue of unemployment. Now, for a long time, we've always looked at the headline or the published rate of unemployment, measured rate of unemployment, as being the key indicator of unemployment in what's happening in our economy. Now, we know that that's not the case in this pandemic. The measured unemployment rate understates the amount of unemployment that we're seeing in our economy at the moment. And what we have occurring at the moment is we have the effective rate of unemployment actually falling while the measured rate of unemployment is rising. And I'm sure that some will take the opportunity to pick their figure as to make whatever case they'd like to make. But why the effective rate of unemployment is so important is it takes into account those who may have gone out of the workforce but in ordinary cases would still be in it, those who are working 0 hours but may not be considered unemployed. I think we have to have a real honest understanding of what's going on with unemployment in this country, and that's why the Treasury have advised, and we agree, that the effective rate of unemployment is the right way to assess where the labour market is at the moment. And what is concerning to me, more concerning to me, I must say, is the payroll data, which shows that the Victorian wave is having this broader impact on the national economy and is in some cases slowing and in other cases reversing the upward trend that we were seeing in employment in the country. That is of great concern to me. And so, inflation traditionally shows a level of activity in the economy, a letter of positive, in acceptable bounds of positive tension in the economy. And clearly, the impact of the pandemic, which has produced the COVID recession, is having a negative impact on our economy. I think everybody understands that. So what do you do about it? What you do about it is you get Australians back into jobs. You provide JobKeeper, you provide JobSeeker, you pay cash flow support, you give the instant asset write-off, you do Home Builder, which is proving to be a tremendous success. You provide support to the entertainment industry. You go and get films to come and base in Australia. You put $1 billion into skills training and create 340,000 places and support 180,000 apprentices. That's what you do, and that's what we are doing. And in the budget, there will be more. But for now, we are focused on delivering the supports which are keeping people in jobs and keeping people in business, and we are focusing on the health pandemic, so we're saving lives and we're saving livelihoods. Thank you all very much.